This is the second part of the Staphylococcus lecture, and in this section we are going to discuss the diseases caused by Staphylococcus aureus. Staphylococcus aureus causes many types of diseases. It causes skin and wound infections such as impetigo, furuncles, carbuncles, boils, as well as surgical wound infections. It causes food poisoning, and it causes a disease called scalded skin syndrome. You can see in the picture on this slide, this is a picture of a type of impetigo called Bullous Impetigo, and we will talk about this disease in a few slides. Staph aureus also causes the disease toxic shock syndrome, which is a toxin producing disease, and other infections. Sometimes it causes various respiratory infections. It can be the cause of bacteremia or bacteria in the blood, which is a systemic infection. It can also cause bone infections such as osteomyelitis. The types of diseases are cutaneous or skin infections, very deep lesions deep into the tissues, as well as diseases caused by the production of various toxins. These are the typical sites that Staphylococcus aureus tends to cause infections. So Staphylococcus aureus causes eye infections such as styes, can cause sinusitis, causes skin infections such as boils, carbuncles, furuncles, can lead to endocarditis or an infection in the endocardial lining around the heart. It can spread throughout the blood hematogenously and cause bacteremias. It can cause respiratory infections such as pneumonia. It has a food poisoning association that causes diarrhea and possibly vomiting. So there can cause bladder infections. There's many different types of infections that Staphylococcus aureus can cause. The cutaneous infections are folliculitis, which is an infection of the hair follicle. I'm pretty sure almost everybody has had an infection of a hair follicle at some point in their lifetime. It's usually a very minor infection, goes away on its own. Furuncles are boils, another skin infection. Carbuncles is a furuncle that gets into the subcutaneous tissues. And impetigo is a type of skin infection that Staphylococcus aureus causes that's very common in children, and it's also extremely highly infectious. So a child with impetigo will not be allowed to go to school until that infection is resolved. These are pictures of folliculitis. Sometimes it happens in one hair follicle. If someone gets an ingrown hair, it can happen in many hair follicles, like you can see in the picture on the left. Usually it just leads to a little raised lesion at the base of the hair. A furuncle is a boil, which is a skin infection that can be a little bit pussy or oozy. A carbuncle is very similar. It's a boil that is a little bit deeper into the tissues. Impetigo is that highly infectious skin infection, very common in children. This is a type of impetigo or bullous impetigo where the skin infection gets a little bit deeper. The area will be really hot. It'll blister up. It might burst open and it'll be very oozy. Some of the deeper infections that Staphylococcus aureus can cause are cellulitis, bone infections, arthritis, can cause abscesses in organ tissues, and endocarditis, which is more common in injection drug users, could cause pneumonia, enterocolitis, and wound infections. Cellulitis is an infection that is deeper into the skin, so it's into the subcutaneous tissue, usually will cause swelling in that area. It'll cause redness. If you touch that area, it'll be very warm to the touch. The toxic diseases caused by Staphylococcus aureus are some of the more severe diseases that Staphylococcus aureus is involved in. One is staphylococcal scalded skin syndrome. This is generated by the scalded skin toxin, SSS toxin, Staphylococcus scalded skin toxin, which is that exfoliatin that will cause the skin to just peel off. Staphylococcus scalded skin syndrome is much more common in children, kind of like impetigo is more common in children. Staph aureus is associated with food poisoning, and specifically it's the staph enterotoxin that's produced, and this is a type of intoxication. So we're going to talk about through this during this course. There are organisms that cause foodborne infections. Those are organisms that the bacterium gets into the intestine and causes destruction of the cells in the intestine, and might lead to a foodborne infection and will cause diarrhea. However, there's another group of infections. Well, and they're actually not infections. That's a misnomer. There's another group of diseases that are foodborne, but they're actually not caused by the organism infecting. They are caused by eating a pre-formed toxin. So in this case, Staphylococcus, since it's all over us and all over our skin, if someone were to touch some food and they had Staph aureus on their hands, and it was a toxin producing strain of Staph aureus, if that food were to sit out at room temperature for a very long period of time, the Staphylococcus that's on the food is producing this enterotoxin. So if you normally went over and ate something with Staphylococcus aureus on it, you're perfectly fine. Staphylococcus aureus is everywhere. Your stomach is going to kill the organism. You would not get an infection. But if you eat something that has the enterotoxin in high enough levels in that food, you get what's called food poisoning. So there's a difference between food poisoning and foodborne infection. Food poisoning is ingesting the toxin from the organism. So this is a type of intoxication, and it usually leads to, within 20 minutes after eating something that has the enterotoxin, an individual will start getting intestinal cramps, have severe diarrhea, possibly get nauseous, and vomit. Usually it's 1, 2, maybe 3 episodes of vomiting or diarrhea, and then it goes away, resolves on its own. It's usually very quick. The worst disease caused by Staphylococcus aureus and toxin production is toxic shock syndrome, caused by the toxic shock syndrome toxin 1. So staphylococcal scalded skin syndrome, try to say that one 10 times in a row very quickly. It's kind of a tongue twister. Again, exfoliatin producing strains of Staphylococcus aureus. The toxin is absorbed into the blood. It's much more common in children, and it causes the skin to be highly sensitive to the touch, and it causes it to peel off the body. So here are some photos of children with staphylococcal scalded skin syndrome. You can see the picture on the right where the skin on the face is just peeling off. We already talked about food poisoning, where it's an intoxication and not an infection. The foods commonly involved are meats, salads, and any type of creamy food. Causes vomiting and diarrhea, usually within 1 hour and up to 5 hours after eating, and it can last for up to 3 days, but normally it's a very fast acting, a few episodes of diarrhea, and then the individual is fine. Toxic shock syndrome is a disease that at one time was much more common in young women. How it was identified was, I believe it was back in the 80s, late 70s, early 80s. I'm pretty sure early 80s. A lot of young women were showing up in emergency rooms with high fever, muscle pains, just very, very sick, and many of them ended up with very low blood pressure, hypotension, organ failure, and many of them died. So because there were so many of these young, normally healthy girls showing up in emergency rooms, there was an epidemiological study that was done to try to figure out what is causing all these healthy young women to get very, very sick and possibly die. So it was found that these individuals had Staphylococcus aureus. The toxin was identified, this toxic shock syndrome toxin, and what was found was all of these girls were menstruating and they were using the same brand of tampon. This particular brand of tampon was highly absorbent, and what was happening was these individuals were leaving the tampons too long before, removing them and putting a new one in, and these tampons had Staph aureus that was producing this toxin, and it just this toxin was getting released into their bodies. So though that brand of tampon was immediately taken off the shelves, and for a long time women were told, don't use tampons. Now tampons have been improved and have not been associated with toxic shock syndrome, but that is how toxic shock syndrome and its association with Staphylococcus aureus was discovered. Staphylococcus aureus can be transmitted in many, many different ways, and it can cause various types of infections like we already discussed. So inhalation, and that could lead to a respiratory infection such as pneumonia. Direct contact can lead to a skin or a wound infection. Ingestion of the toxin, not the organism, can lead to food poisoning. And endogenous, you can infect yourself with your own Staphylococcus aureus that is normal flora on or in your body. Control and prevention of Staphylococcus aureus. A lot of hospitals have begun screening brand new hospital staff that will be directly interacting with patients, as well as hospital staff transferring from one hospital into another hospital. So these individuals are screened, usually a nasal nair in the nasal passages, it's called the nairs, are screened for carriage of Staphylococcus aureus. If an individual is carrying Staphylococcus aureus, many times the hospital will force the individual to be treated with antibiotics to try to get rid of the Staphylococcus aureus before being able to be interacting with patients. In addition, patients that inpatients that are colonized with MRSA will be isolated. They might be given their own room so that there's less risk of transferring their MRSA organism to another patient in the same room. Linens and clothing in hospitals, of course, are sterilized. Barrier precautions are utilized by staff and visitors. So, of course, whenever you're interacting with a patient, you'd want to wear gloves. You wouldn't want to really be interacting from one patient to another without putting new set of gloves on. And individuals that are have carrying MRSA or maybe have a MRSA infection, each hospital is going to have very stringent requirements. They might require the hospital staff to wear masks or, do various things in order to try to reduce the transmission from one patient to another. There have been Staph aureus outbreaks, and trying to detect the carriers in those outbreaks to treat them and minimize the risk of transmission has been done as well. In chronic infections, the main thing is trying to prevent that person from getting reinfected with Staph aureus. People that are carrying Staph aureus in their nasal passages, they might be given nasal creams that contain antibiotics, or usually an oral antibiotic therapy will be given to try to get rid of the carriage. We already mentioned that. Proper refrigeration and preparation of food, so that if you have Staph aureus on the food, it isn't generating toxin and generating food poisoning. And also monitoring individuals for carriage of MRSA, and if an individual is infected with Staph aureus, determining if their Staph aureus is resistant to methicillin or not. So Staphylococcus aureus that is not producing beta-lactamase. So beta-lactamase is an enzyme produced by many bacteria that will allow the organism to resist being killed by any of the beta-lactam antibiotics, such as penicillin. So for Staph aureus that are not producing a beta-lactamase, in other words, they're a methicillin susceptible Staphylococcus aureus that is not producing a beta-lactamase enzyme, they can be treated with penicillinase resistant synthetic penicillin. So beta-lactams include penicillin, but they are susceptible, these organisms are susceptible to being treated with methicillin, nafcillin, oxacillin, and dicloxacillin. For methicillin-resistant Staph aureus, such as MRSA, or methicillin-resistant Staph epidermidis, you can treat with vancomycin combined with other antibiotics such as rifampin or gentamicin. And there has been the emergence of vancomycin intermediately susceptible or resistant Staphylococcus aureus. So for individuals that might have a vancomycin resistant strain of Staph aureus, these individuals have infections that are incredibly difficult to treat, and you have to use much newer antibiotics and various combinations of several antibiotics to try to treat those infections. Some of the future concerns regarding Staphylococcus aureus is it seems to be increasing in its frequency. I don't think anybody, you can walk down the street and tap anyone on the shoulder and say, hey, what do you know anything about MRSA? And I'd have to say at least 90% of the individuals would know something about it. It's so common that it's all over the news. MRSA used to be considered a hospital-acquired infection. It is no longer only a hospital-acquired. It is community-acquired. It's pretty much everywhere. It's becoming more and more resistant to a wider range of antibiotics, such as vancomycin, and there are these vancomycin intermediate susceptible Staph aureus strains, and there have been some vancomycin resistant strains that have developed. Treatment of Staphylococcus aureus infections, it depends on the site of infection. So in the case of a wound infection, the wound would need to be drained, and usually antibiotics are going to be given. If it's let's say a bladder infection due to having a catheter, you'd want to get rid of that catheter. Catheters are notorious for increasing an individual's risk of infection because you have a foreign material that is in the body, or in the case of a catheter like a bladder catheter, you have a tube that's going from outside into the body, which is bringing a nice vehicle for organisms to get inside the body. Treating with antibiotics, possibly penicillin, depending on the strain that the individual is infected with, vancomycin if it's a MRSA strain, erythromycin, and in the case of enterocolitis, possibly not giving antibiotics at all. It depends on the severity of the case. So now we're going to move on to part 3 of the Staphylococcus lecture.